Okay, I'd like to get started now. I'll be admitting people as they sort of appear, but thank you very much for joining us. This is the inaugural webinar. We've had some in-person panel discussions before, hosted by the Center for Services Marketing and Management here at FAU's College of Business, but this is the first time we've had a virtual webinar, so thank you very much for attending. This is being recorded and will be posted to the center's website. So once that happens, I'll send an email to everyone just to let you know. And if you'd like to watch it again and share it with folks, I'd appreciate that as well. If you could, please stay muted just so we're able to hear the panelists. And if you have anything with regards to a question or comment, we welcome that. Please post that to the chat. I'll be monitoring that as well. I'll take some time now to introduce the panelists as well as our faculty expert, and then I'll turn it over and we'll get this started. First, I'd like to introduce Raul Daza, MD. He's the Regional Medical Director for Sanitas, and he's the clinical leader for that organization. He's responsible for recruiting and developing a high-performing team of physicians and clinicians across the entire network in the US. In addition, he works closely with the leadership team to implement strategies that enhance patient care, including quality assurance, protocol and care guidelines development, cost management, and patient engagement. Raul was born and raised in Boca Raton, Colombia, where he attended medical school. In 2001, Raul moved to the US to complete his internal medicine residency at St. Luke's Roosevelt Hospital in New York. He is board certified by the American Board of Internal Medicine. And before Sanitas, Raul worked in Miami as a hospitalist. I want to also share with you something that he posted to his profile on Sanitas, which I think tells you quite a bit about Raul, not only in terms of his experience, but also his perspectives. He says, one of the best things about medicine is that I get to meet new people every day, interact with them and help them live better lives. Knowing that I can make a difference in my patients is extremely rewarding. For me, a world of health means a complete approach to healthcare, focusing on the whole individual, not just their physical needs, but also mental, spiritual, and emotional ones. A world of health also means that health goes beyond the individual to include the family and their social environment. Welcome, Raul Daza, MD. Thank you for being here.
Thank you very much, Andrew, and the organization for the invitation. It's a pleasure to be here, and hopefully we can share a lot of experiences together and learn from each other.
Wonderful, thank you. Next, I'd like to introduce you to Nicole Cable. I've known Nicole for, my gosh, it's going on probably 10 years now, right, Nicole? And you look younger every day, so thank you very much for being here.
Thank you.
Nicole Cable serves as the Chief Experience Officer of InovaCare Health. Nicole has served in a number of executive roles, including Corporate Director of Patient Experience Programs for the ChenMed family of companies. In her Miami-based role, she was responsible for designing, implementing, and evaluating programs to enhance patient experience. Nicole now, or has in the past, also serves as Director of Patient and Guest Experience at University of Maryland Laurel Regional Hospital, the largest provider of healthcare services in Prince George's County, Maryland. She was responsible for overseeing and managing strategies targeted for outstanding guest experiences. A certified patient experience professional, she also serves as an advisory board member for the Barrel Institute, a global community committed to elevating human experience in healthcare. Nicole earned her Bachelor of Science and Master's degree in Health Services Public Health at Excelsior College. In addition, she is now a Ph.D. public policy candidate at Liberty University. So thank you very much for being here, Nicole.
Thank you. Thank you for having me. I'm excited to be here. Looking forward to sharing and learning from everyone else.
Thank you very much. And next, I'd like to introduce Alex George. Alex is an accomplished strategist with more than 19 years of experience in human resources, service culture training, leadership development, and quality assurance. He currently serves as Director of Training and Quality at the iconic Boca Raton Resort and Club. Alex is responsible for directing and implementing various training initiatives to elevate the 356-acre property toward achieving higher service standards with Forbes Travel Guide. In 2018, Boca Raton Resort and Club was named 4 stars by Forbes Travel Guide for its Boca Beach Club and Spa, respectively. Since April 2016, Alex has served as adjunct professor at Florida Atlantic University in the Hospitality Management Program. Alex is a certified professional in talent development and a certified hospitality trainer. Alex is currently pursuing a Doctor of Business Administration from Florida International University. So welcome, Alex. Thank you very much for being here.
Thank you, Andrew, for having me. And I really look forward to collaborating with everyone today and learning more.
Thank you very much. And I'm really humbled by the fact that these three exceptional people have dedicated or provided their time and expertise here today. Last but not least, I'd like to introduce our moderator for today, the faculty expert, Melanie Lorenz, Ph.D. She is an experienced assistant professor at FAU, a native of Germany. She has worked in banking and consulting. After studying abroad in Mexico and the US during her undergraduate studies, she then decided to become an academic and earn her PhD in marketing from the University of Alabama Roll Tide in 2016. She has been an assistant professor at the University of Toledo, Ohio, before moving to FAU. Her research is focused on micro and macro level issues at the intersection of marketing and international business. Specifically, her interests include cross-cultural service and sales encounters, cultural intelligence, innovation, and creativity, as well as the impacts of cultural and gender diversity on firm outcomes. In her free time, she loves traveling, immersing herself in new cultures, and enjoying the outdoors. Melanie, thank you so much for agreeing to moderate this session. And at this time, I'd like to hand it over to you. Thank you.
Thank you so much, Andrew, and welcome everybody. And I'm really excited to get so many different viewpoints from all of our experts and also from all of our audience today. And I think we have a wide variety of industries, experiences, and backgrounds, which will make this discussion really, really lively. So why don't we just jump in right away? There's no need for any more introduction. We're talking about cultural sensitivity, and culture is something we experience every minute, every day of our life. We are exposed to it if we see it immediately or not. When I briefly talk with my students, or not so briefly, about culture, I always tell them culture is like an iceberg, right? We see 10% of it, but 90% is actually hidden. We have to understand it. We have to create awareness. We have to create sensitivities. So that's kind of alludes to our first question. How do we go about cultural sensitivity, and how can we actually, as companies or as whole industries, use cultural sensitivity to create a competitive advantage for service organizations? And I open up the floor to our experts. Whoever wants to start first.
I mean, I
Go
can
ahead. Yeah.
I think it's very, very important that we are culturally sensitive in today's world. I mean, organizations are no more operating in one particular market, right? I mean, we are expanding, we are looking at new horizons, trying to go beyond the geographical boundaries, especially if the company is based off from the US, trying to explore new markets. So I think it's extremely important that we place cultural sensitivity at the forefront of what we do, because it definitely leads to increased innovation, acceptance in new markets, and obviously problem-solving capability as well. What I've also found, especially in recent times with a lot of influence of media on various aspects of what we live in today, is it also leads to brand loyalty as well, and as well as brand awareness. So I think it's an intentional change on part of an organization to pursue that path.
Alex, just picking up on this, where do you see it in your work specifically? Do you have an example where you felt, hey, we made a difference because, or we created more customer loyalty, better relations because we were sensitive?
We, especially being in hospitality, we see so many different customers and clients from different cultures, coming into one particular hotel or property. So, by understanding that, especially say, for example, in the dining habits, right? People have different perspectives on dining habits. To be culturally sensitive in regards to that, some cultures like to eat a little earlier in the day, versus some cultures like to eat probably past 10 o'clock, 11 o'clock in the night. So by making sure that there is something for someone at any given point of time, understanding that having dinner at 11 p.m. in the evening is not late, but it's the norm. That could be an example that I want to share with you.
Thank you, Alex. Nicole.
Thank you. I agree with Alex. I think it's very important for an organization to really focus on cultural sensitivity. and diversity, being in healthcare and also formal lodging, I can think of many examples of how it's been beneficial for us from a healthcare perspective. Understanding the needs, wants, and desires of our patients culturally allows us to have better outcomes. You know, we can build trust in the type of care we're delivering, then they're more likely to listen to us, which then leads to better outcomes from a health perspective, which then lowers costs of healthcare and also many other downstream effects. So understanding the people that you serve and being culturally mindful of what matters most to them by asking those tough questions and just getting out of your own comfort zone and learning more about someone else's culture. I like the introduction for you, Melanie, when you said that you immerse yourself in other people's cultures. I think that that's really important, particularly in the world we live in now. So I think having that diversity in what we do will help us be stronger as organizations and keep us and get that brand loyalty.
I'm going to turn it around on you, Nicole, now, as opposed to Alex. I'm going to ask you, did you see your experience where cultural non-sensitivity or not being sensitive actually created problems? Because when I talked to my student, I was like, we probably learn more about failed attempts than from what others do good, right? So yeah, any experience to share?
I can think of one that was pretty brutal. In a former role I had in a hospital, we actually had a patient who was on her way, her and her family were on her way to treatment at another hospital and took ill on a plane. Had to be sent to our academic hospital where we realized she had advanced stage 4 cancer. And their culture, she did not know she had cancer. The husband knew, but the wife did not know that her cancer was that advanced. And that was by design. And so I remember of course, us Western, we want to say, hey, tell her everything, be transparent with the patient. But I remember when the doctors kind of came in and dropped it on her that she had cancer and she probably wouldn't survive. It was as if the life just simply drained from her body. And I can remember us fighting to get her daughter in the States in time before she passed away. And there were so many things that we did along the way that really made that a bad experience for not only her, but for her family and for her children, that we really had to take a hard look at cultural sensitivity, because just because we do it one way in the Western world doesn't mean that that's how it's done around the globe. And it was very heartbreaking because she was so positive and so optimistic that she was going to beat this disease. And I know the doctor didn't mean anything bad. He wasn't coming in to be, a Debbie Downer, so to speak, but he was just being very blunt with the diagnosis. And I think he lacked empathy when he was delivering it. And so it just opened up a whole can of worms, as we would say, for us and in guest experience, patient experience, trying to calm that situation down. But it did lead to us training our providers on cultural sensitivity. So it was a bad experience, but we did learn something out of it, and we were able to help the family with the burial. We learned more about what that looks like, how that works, and so it was multiple departments that had to chip in, but it really did make us aware because we're a large academic hospital, so we see patients from all over the globe about other cultures, and so that was kind of our wake-up call, was that situation with that particular patient.
Thank you so much for sharing this with me. I didn't think we would get so much information out of this, but it was really interesting to hear. And when we always think about culture, right, we think about other countries and things, countries being, or people being far away from us. We don't encounter them so much, but we have so much diversity just within the places we live that we have to be prepared for all these circumstances, even if we cannot see when we look at patients, that they look different, that they might have a different culture. So thank you, Nicole. Let's move on to Raul. Probably pretty close related to what Nicole was saying.
Yeah, absolutely. I mean, being in the healthcare industry, being a doctor, you have to be very culturally sensitive. The example that Nicole gave is just one of so many, and we can go to the extent of advanced cancer to a simple example of trying to explain to a patient what he should eat or not eat because he's diabetic, right? That's an example that I use all the time with medical students that we have and everybody else, because diets are very different, right? Alex was talking about times of eating. That's one thing that for some people, you know, rice is a staple in their food. I mean, I'm Hispanic and we eat rice every day, and if we eat it 3 times a day, that, you know, I'm not exaggerating, and some people more than others. And if I come to a diabetic and say, hey, you have to take this away from your diet, they're not going to trust me. There's not going to be any empathy. There's not going to be a connection in that relationship, because I simply don't understand where they're coming from. So in order for them to understand from the medical side, the treatment that we want to do, we need to understand where they're coming from and how do I create that trust and that connection. I said, Nicole mentioned that word, the trust. And I think there's nothing more important in our industry, healthcare, or any other industry, for you to create trust and a connection, whether it's to your brand. Our company, the origins of our company is in Latin America. And when we came to the US, yes, the first patients that we got were Hispanics down here in South Florida. But we live in such a diverse community that it's not the same to open an office in, you know, the Homestead area or the North Miami area, where in North Miami area, there's such a big Haitian influence, and their culture is completely different. And not only that, but within our Hispanic community, there's a lot of cultural differences. It's not the same if you're Mexican or if you're Colombian or Venezuelan or from the Dominican Republic. So, you know, cultural sensitivity, we talk about it a lot in our industry, because we want to create that trust and that empathy, in this case with our patients, or, you know, also our clients, but our patients first.
Thank you, Raul. So coming from this, I'm just going to stick with you right now, because you were just responding to me. How do you go about making sure that your employees are culturally sensitive? How do you put these processes in place? And it's easy to say, right? When you say, I look at Latin America and say, well, it's Latin America, we have to act a certain way. But how do we even like these fine nuances and having even other cultures interacting with this? How do you go about making sure your employees are sensitive?
Yeah, I think it starts from hiring and being aware of what the needs of the community where we are at that particular time. So like I just said, if I'm hiring for an office in the North Miami area, I want to look for employees that are relatable to that community, especially in healthcare. We want to build that trust and that empathy. So it starts with the hiring process, right? And then on the onboarding process, making sure that, you know, respect for all cultures and races and ethnicities, that we talk about those things, that we talk about that there's differences, that people might have preferences, not only in the you know, treatments, but, you know, whether being seen by a male physician or a female physician. So being aware, making sure that we are culturally diverse inside the organization and that we reflect the community where we are in. We started expanding to other states, and right now we're opening offices in Tennessee, and, you know, it's completely different from South Florida. So I think it starts with the hiring process, and having that conversation all the time, right? From the hiring to the onboarding, and then continuing with plans within the organization regarding cultural sensitivity. You know, it's an ongoing process. It cannot be something that we just mention and it's out there, but it's part of the company's culture. It's part of the mission of the company as well, to be culturally sensitive and culturally aware.
Thank you, Raul. Going over to Nicole.
I agree totally. For us, we just started our journey. Well, we started a while ago, and our organization is pretty diverse. It's pretty minority. I mean, we're about, I don't know, maybe 80% women and like 95%, you know, minority. So we're a pretty diverse organization, but yet we still realize that there's more work to be done, and that's because of our CEO really driving that home. So one thing that we've been doing is around implicit and explicit bias. And that's a really big one, because a lot of the times we make these sweeping assumptions as individuals of what we think is the truth, and it's not necessarily the truth. It may be through our lens, but maybe not through those who we serve. So making people aware and offering tools so they can understand their own biases is half the battle. So you will have your biases because the brain is wired the way it is because of experiences that you've had. However, if you're aware of those biases, then you can be much more aware of them, and you can measure your responses and be mindful of how you interact with people and how we deal with stereotypes. I mean, that's a big deal for us in healthcare. We see patients or a family member and we make assumptions, and that's bared out in literature. So just making our staff aware of that, putting it in front of them, and then giving them the tools of how to address it, I think are very critical. And we're just very fortunate that our CEO is one of the drivers for this within our organization. So it filters from the top down to our front lines through all of our organizations. So I think for me, I think we're pretty blessed to have that ability to do that in InovaCare Health. But you do see it in other, because we contract with other practices. And so we find ourselves offering these type of trainings and services to those IPAs as well, so that we're all on the same page, building that trust with our members, if it's a part of our plan, or our patients, if it's our provider offices that we own.
That's a good point, because it's not a seamless transaction always. The service experience goes beyond various providers. So that's an interesting point, that you're even at this stage that you can offer trainings to other in order that the experience get actually fulfilled to its completeness.
Yeah, we're fortunate. Like I said, we have a really strong leader in the organization that's driving a lot of this for us. I mean, he's from mental health to diversity. I mean, he's there. So we're very fortunate again to have him as a leader. And so it's not hard to stand up programs. And it's interesting because the doctors want them. I mean, they're, if you can give them what they call turnkey, and you can deploy it to their staff, it's something that's of value to them, and they understand that value. Because again, I think providers always want to do a good job. It's just, giving them the tools to do so. It's not necessarily taught in medical school. So it's not taught in any school, to be honest. I mean, to some degree, we're finally talking about it more because of things that are happening in the nation. But I think it's a great thing that FAU is actually doing this today and having us have this discussion around diversity and cultural inclusion and humility. So I'm excited to be a part of that today.
Thank you, Nicole. And we didn't forget you, Alex. So how do you facilitate cultural sensitivity in your organization or in your function, especially being in charge of a lot of employees?
Well, I completely agree with what Raul brought to the table. Like, I think it all starts with hiring, right? I mean, for us, it's extremely important that we hire the right people. We believe that, you hire for the attitude, right? And then the knowledge and the skill can definitely be added onto it. You can always teach someone how to do a particular task. So having a little bit of that emotional quotient as well is very, very important. That I'll give a simple example, something that we can all empathize with in today's pandemic world. As hotels and organizations started to reopen, everybody was looking at ideas about how do we welcome a guest back to our properties when we all have a mask on our face, right? I mean, they don't see our smile, they don't see our facial expressions. So there were different schools of thought in terms of why don't we do like in the namaste, like you would do in the Asian culture? Why don't we do something, bend and, put your hand on your heart and, do something similar to that. It's very important to know that, different cultures would perceive that in a different way. Like, just bowing your hands and doing a namaste wouldn't give you the credit if it was an Asian guest. Especially say, for example, in terms of Japanese guests, right? I mean, just by bowing your head, it is necessarily not going to make them, understand that. There are many different nuances, like, are you bowing a little? Are you bowing too much? I mean, that all comes into the perspective. So instead of, really trying to wow someone, you could have an opposite impact on it. So I think it's a lot of, there is a lot of influence that the employee brings to the table as well by, being open-minded by grasping information from media, the good things from the media, right? The training sessions. I'm a firm believer that, you can definitely do tons and tons of trainings, but, it needs to be actually implemented back in the workplace as well. So, it all boils down to having the right people on board, the right team to constantly reinforce these ideas and, Nicole was saying, having the right people to champion behind it. So I think that's where we are extremely successful when it comes to understanding the customers, from a cultural sensitive perspective. It can go in many ways. I want to give a quick example. I heard this from someone. I'm not sure whether it really happened, but at one particular, organization, they really wanted to wow someone as this person arrived to their organization, and they decided to give a small gift. And the gift was actually a clock. And to the dismay of the organization, the customer was really, really upset with the gift, because in the customer's culture, the clock as a gift indicated a sign of death. So instead of having a really wow effect, it was a completely opposite effect for the customer. So, there are a lot of things that it's not a cookie cutter method.
Thank you, Alex. Just picking back up on it, do you see in your selection, or even Raul and Nicole, do you see that it's a change in the applicants? Do you see that people are more diverse, or more even reacting differently to cultural diversity, cultural sensitivity? We see more and more people are traveling, not right now this year, but in general, they have more international experiences. Do you see a change, a bigger awareness for the need, even in your applicants?
Yes, absolutely. Absolutely. There's a wide population. We're blessed. I always say that we are in South Florida, where there is a large pool of talented individuals, both going to school locally here at FAU, Lynn University, FIU, Johnson & Wales. And they all necessarily don't live in Florida. They come from different parts of the United States, different parts of the world. So I think we're blessed that we have naturally a great pool of talents that understands that cultural sensitivity is extremely important, and especially in our business, in the hospitality business. And I think that's what's the most important thing, because like I said, the training is just a kind of a reinforcement. It's kind of like a reminder. And it can only do so much, right? But having the right people definitely makes your life so much easy.
Thank you. Nicole, you wanted to pick up on this?
I was going to say, yeah, I think that's a really important, obviously, the implementation down to the front lines to understand what it is. I think our approach has been include the front lines. So like when we were working on diversity and inclusion, we asked our own staff, like, what does it mean to you? Like, what does it mean to you? And the responses were amazing. I mean, and people thought it would be different because we're all over the place. We're in Puerto Rico, we're in Florida, we're in New York. So some would think that the responses would have been very different, but they were all the same. And it was really an eye opener for certain people who had the perception that it would be different, that people didn't see diversity in a different way, being on the mainland or on the island. But it was very interesting to read the comments. And so we took a lot of that information and folded into the work that we're doing now. So, it's still growing. We're still learning from our staff. They bring us ideas on specific things they want training on. But for me, it's understanding what the cultures are, at least the basis of those cultures. And that's something that I was introduced to again at the academic hospital. We joined this chaplain group that's out of New York, and I can't remember the name, and I apologize, but I joined them in all the roles I had except this one for spiritual care. And they put together a pretty nice document about religions and about beliefs in the United States. And it broke it down by different subgroups. And I remember sharing it with with the providers that I worked with. And I said, hey, this is about, because they saw a lot of Haitian patients. I said, take a look at this and tell me if this is accurate. And I remember the doctor emailing back, and I'm like, OMG, this is all of my patients. And so it was nice for him because he got to understand a little bit more of their views on death and dying, who makes the decision in the family. Now, it's not going to be a hard and fast rule for everybody, because you do tend to assimilate when you come to a new country and so forth. But for the most part, it allowed them to change how they practice. In other words, how they spoke to the patient and the family, because in some cultures, the family is just as important as the patient. And so they were able to adopt and change the way that they interacted with certain groups that yielded better results. And in fact, in our surveys, because we did CGCAPs, which is a CMS survey, we would see it come out in our verbatim. Now, there aren't any questions around cultural diversity in CGCAPs at all. You know, it's like, okay, we get demographic information, but nothing about how we practice it. But when you did do it right, the verbatim comments tell everything to us. So we knew we were doing something right when we started getting the feedback from our patients. Also, the disenrollments, they didn't leave the practice, they stayed with their doctor. And outcomes became better. So it just was something that we used. Again, it's not a hard and fast rule. It's not every patient you take care of that's going to follow this guideline, but it at least allows the provider and even us to ask those questions like, okay, well, I understand a little bit about your culture, and I understand that this is how your perception of this is this accurate for you, right? And then make it say, yeah, kind of like that, but not anymore because I'm here in the States now, so I've changed a little bit. My mom's that way, but maybe I'm a little different. So I think giving people tools that they can ask those questions of the patients and their families allows us to personalize the service that we deliver, which gives us the better outcomes that we need in healthcare.
Thank you. Raul, similar experiences in that?
Sure. I'm just, I mean, I hear Alex and Nicole, and I just keep thinking of a lot of different things. I mean, I think it's very difficult, right? And we talk about cultural sensitivity and promoting cultural sensitiveness. You just have to keep the conversation ongoing, I think, because you're learning every day. Right. When I say this, I don't think that I'm saying that we know. I don't think we know how to do it properly either. Yes, we try to hire a diverse group of people. We try to be sensitive and aware. I think that's what you can ask for. But you're always learning. It's happened to me as a doctor, and it has happened to me as a in the leadership position in both ways. When you're seeing a patient, and especially, the certain cultures, a female patient will not be in the room with a male doctor, and you have to be aware of that and learn, right? And make sure that and those are things that, that if you're talking to your staff about that from before, you can avoid those situations, right? And then also learn from them and how to avoid them in the future. So I think it's very difficult, and sometimes more difficult it is for me when the person on the other side, the patient or the client, doesn't show that cultural sensitivity or awareness, right? And I think that's even more difficult to manage, and we have to talk about that as well, because I might have a very diverse staff, right? But if those patients that are coming in, don't understand that or don't see it, it's difficult. I have some staff members. I mean, like Alex said, we're privileged that we get people from so many different backgrounds, ethnicities, and cultures and languages. So my first language is not English, it's Spanish, right? So we might have some doctors who are excellent doctors, have all the knowledge in the world. They have the best intentions, but their English might not be that good. And then we face a patient that is very difficult for them to understand that this is a good doctor, that he has the best intention in you, because the patient was the one who wasn't culturally sensitive. So that's, difficult, and I don't even know how to address that. We talk about it all the time. We apologize. We offer a different doctor, but it's difficult. I think this is a very, very tough, question that we are discussing today, a very, very tough topic. But I think this is how we start talking about it, getting a diverse group of people to talk about it, like you guys did in the university. This panel is very diverse, and making sure that the conversation is an ongoing conversation, that you start with the hiring, but you take it along the way. And it's part of the culture of the organization as well.
That's an interesting point, to see this cultural sensitivity as a two-way street. and just really thinking about how cultural sensitive I need to be if my customer is not, because it means I have to reassess myself even further. But at a point, there is no way out. So, and how do you avoid confrontations, right? And all these things. Alex, did you have similar experiences where you experience too many or too much lack of cultural sensitivity from the customer per se? And how would you go about it? Or how do you tell your employees to go about these facts?
Not necessarily something that comes to my mind right now in regards to cultural sensitivity, but I think Raul has a great point. Absolutely, it's a two-way street. We do a lot of work, each and every one of us, right? We do a lot of work by training our team, by training ourselves as well, to make sure that we learn something new every day. We are culturally sensitive, but we never thought too much about the opposite side, right? I mean, we can't really educate the customer too much on, cultural sensitivity. We just assume they are culturally sensitive. We just assume that, they read a lot and they understand how things are changing around the world. But we obviously take it very seriously, right? In the hospitality business. One example I can think we can all relate to is about face masks, right? I mean, there are some customers who may not like to wear the face mask, right? So it's a general reminder that why it's needed and how it is beneficial for them and how it would benefit the society they are in right now. Where by society I mean in the context of the people around them at that particular location where they are. So I think that's the way we definitely would like to approach that, and by being humble and reminding them that it is important, but no examples that comes to my mind right now.
I didn't mean to put you on the spot.
Absolutely not.
No, I think I got his back. I have one. So I'm happy to hear.
But I think it's very important that and one thing before Nicole takes over and supports me is I found it very interesting from Raul that how we learn each and every day. That one of the things that I learned in terms of cultural sensitivity is in these challenging times when we're going through this pandemic, sometimes I don't know, as a culture here in the US, probably we get straight down to business, right? Hey, what's going on? Are you are ready to come back to work or something like that, right? It's very important that we have incorporated into our organizational culture that we really understand our team members, we really understand the employees. So we never get down to business immediately. We always ask about family first. I think, both Nicole as well as Raul brought that up. Understanding the family is very important. Understanding how they are doing, how they are taking care of themselves, how are their, wife and kids, and sometimes I know the names, so I ask by names, and I think that rapport is very important. So I just wanted to pitch that in and add that is essentially very, very important in today's world. And when we talk about cultural sensitivity, like bringing the family component into it is super important.
Thank you.
Yeah, I think Raul nailed it with the two-way street. I mean, I'm trying to give one example because there's many, being in healthcare as long as I've been in it now, where I've had patients not want to be treated by a certain individual because of a skin color or a religious preference, or they just were not aware. And, I have this thing I've been using since I was in customer service myself many, many years ago. I always use a Qtip, which is which stands for quit taking it personally. And I always tell the staff that I had, because I can tell you from my own personal example, I was doing customer service. I had a customer called me a couple names that I will never repeat here, but were pretty bad. And I was pretty polite, pretty professional. And I could have done two things. I could have snapped back and gave him what he gave me and hung the phone up and been justified. Or I could have stayed above the fray and say, you know what, I'm not going to get in there with him. I'm not going to go lower myself to that level. I'm not going to take myself out of my character. So I choose to say, one moment, please, and give him to a supervisor, vent with people and let it go. And so when I teach my staff around service, it's like, you're going to run into people that are tired, scared, or hungry, right? They're going to be frightened. And sometimes the response they give to us, which is negative, isn't coming from, it can be coming from something they've experienced in the past that makes them see things differently. I mean, I've had customers say, I don't want this person in my house because he's Black. I don't want this doctor taking care of me because she's Muslim. I don't want this because they believe that. And it's explaining to the staff that, look, you're going to run into this, but don't take it personally. It's not about you. It's something that this person is grappling with, what this person is dealing with. And when we get to the core of why they feel that way, and I can honestly tell you there have been situations where we've had that happen, that you have the patient or the customer come back and say, I'm sorry, I was scared, or I had a bad experience with someone, and that's why I have these fears now. And I think when we can humanize it, and you're not going to get every win, it's not going to happen every time, but if you're willing to avail yourself to that conversation, sometimes you can get past that barrier. And so some patients, there's nothing I could do. I'm like, I can't help you in that. You're going to have to go see someone else. I don't have another doctor. But in some situations, they will see their flaws and they will apologize. So I mean, I've seen it, many different ways in different industries that I've worked in. And so it's making sure our staff, I guess, it stays safe, that they feel like this is not an indictment on who you are. You should not feel less than a person because someone has this attitude or these beliefs. You're doing your job and you're doing it to the best of your ability. Because a lot of times we allow it to impact us personally and internalize it. So I always say Qtip it, quit taking it personally, because it's not about you. Actually, it's their own hang up that they're having. And it's funny because staff actually go like, you know what? I almost took that personally, but I know it's not about me. It's something going on with them. So that's just something I've been doing forever, even for myself when I'm interacting with people. And I know there are some preconceived notions because I'm a Black person as a chief. There's not many of us out there. So it's not like they're, seeing this on a regular basis. So I come to the table already knowing that I'm going to be coming into the conversation at a disadvantage. I don't hold it against them because I don't know what their narrative is. I don't know what their life is. I don't know what they went through. All I want to do is like, you know what, whatever you think I am, I'm not, and I'm going to change your mind on that. And so I just stay positive. And if I do it, I do it. If I don't, I tried. I don't take it personally. I don't want to internalize it because life is too short for that. So I just try to look at diversity and inclusion as an opportunity to share and get to know each other. And some people will come along and some will not. So, but I don't cry over it. I simply I move on. So that's my little 2 cents on how I handle the cultural sensitivity when it is negative towards you because someone else's beliefs.
Thank you so much for all of you sharing these kind of experiences with us. Before I poke more around his question, I think we are ready to look at the audience. We got already some questions in the chat, and I will hand it over to Andrew, who will manage this part. Thank you.
Thank you. Thank you to the panelists and to you, Melanie, for an engaging discussion. Thank you very much. I do want to be sensitive to the fact that we had extended this invitation for an hour and that some of you may be on your lunch hour and have other things coming up. So let's turn our attention now to some of the questions, and I invite you to post any comments or questions in the chat. First, I'd like to read a question from Cheryl Burke-Jarvis, which is a great question. It was on my mind too with regard to metrics and measures and assessments. Do any of your organizations include measures of customer or patient perceptions of cultural sensitivity in your satisfaction surveys? If so, what have you learned from tracking those measures, and how do you use the data to improve your performance in this area?
I'll respond. I think that's a great question. We do not have data for that. We use a pretty standard survey tool instrument now, which is we use CGCAPs for pretty much most of our work, whether it's the IPs or even our internal practices. That question is not in there, but that is something that we should definitely look at to see if we are meeting their needs. We look at verbatim comments. We use text sentiments, so we know what our patients are thinking or even their families. But ask specifically about their culture or how they perceive something, we've not done that. We ask more questions now about how do they want to be communicated to? Do they have technology? More social economic questions, which are something that healthcare hasn't done really a great job with. We start doing more of that now, but I could definitely see how that plays in the culture as well.
Yeah, I agree with Nicole. We also do surveys, and every one of our patients actually gets a questionnaire, but we're not asking about cultural sensitivity. And you're right, we should. We're here talking about that, and we're not doing. We ask questions about, was the provider, did he make you feel welcome and listen to you and those type of things? But I don't think there's the cultural aspect embedded in there. And for me, that's a take-home lesson from today, that something that we need to review and see how we can gather that from our patients.
I mean, I totally agree. We just like both of you, we don't have anything very specific to that aspect, but I think it's very important we start measuring it in order to understand our customers' perspective. So I think it's something worth noting it and taking it further.
In my work, which is exclusively in healthcare, one of the projects I'm working on now is doing some data mining of patient comments that come from the CAP surveys. And one of the themes that comes out very, very strongly is their perceptions of compassionate care. So that may be another method for, even retrospectively using the data you have to really assess cultural sensitivities by looking at comments and narratives and patient and guest narratives. On another note, Alex, you talked before about trying to help people feel like they're at a home away from home in hospitality. And this was part of the discussion that, how does cultural sensitivity create a competitive advantage? And one of the questions that I had during that discussion was, to what extent is positive word of mouth and loyalty, people coming back, really determined by how culturally sensitive your organization is? I know in our preliminary discussions, you gave some examples of how you were able to accommodate some groups and really earn their business. You talked about customer loyalty. I was just hoping, I could invite you to share that.
Yes, absolutely. One of the examples, Andrew, I shared with you earlier on when we were, exploring this topic was about, a particular religious group that, comes to one of my organizations, and how we really went above and beyond their needs, and especially with the religious aspects of it. And one of the reasons why they continue to come back to the organization, and I shared with you, I think it was for about 16 or 17 years in a row, how they decided to come back to the organization I worked for. So, I think it's like I mentioned earlier in the day that, when you understand your customer, when you bring that cultural sensitivity to the forefront, it builds that brand loyalty and as well as brand awareness. And thanks to that particular group, we were able to, gain more business from different similar groups as well. And the good thing about having those kind of groups was that the employees who served those particular customers, those particular groups, they were very understanding. I mean, over a period of years, these employees knew exactly what was expected out of them. So there wasn't any need to, of course, training is always important, but there wasn't any need to start from scratch. I mean, when they knew that it was XYZ group or coming, they immediately knew what was expected out of them. So it's a win-win, I guess, right? So the first time you go through this, it's probably is a learning curve, but once you successfully deliver that, I think it is just, you just continue to build on that business.
Thank you very much. And I'm glad you bring up this this expression win-win, because I think sometimes maybe the dark side of understanding cultural sensitivity is acquiescing to someone's preferences in order to get them to do something. Perhaps for instance, Dr. Daza, I don't want this to be portrayed as, well, let's get to know the patient so we can get them to to adhere or comply, but rather have a more meaningful discussion about what they're able to do and what their obstacles and barriers are to that. Can you talk to that a little bit about the connection between cultural sensitivity and perhaps their well-being?
Yeah, absolutely. I think it goes back to that creating a connection with the patient, and a connection that creates trust, right? Because when that patient trusts the provider in front of them, and I'm talking about the physician, but it's the entire team. Here in Sanitas, we have a team approach. If they trust that team, um, they're going to be able to take better care of themselves, and better care of themselves is not necessarily, be adhere to a medication regimen, right? It goes beyond that. It's mental, physical, emotional. I just had a case this morning that was presented to us that we're going to discuss later in a multidisciplinary team. We went to a patient's home because we couldn't reach them, and what we found out over there, or our team found out, is there's a lot of issues there. It's an elderly patient who lives alone. Nobody's taking care of them. There's a lot of issues around that. So the point for us with them is not to connect and say, hey, you have to be taking this medication. Why are you not taking it? Now we know there's a lot of barriers, cultural barriers, language barriers, socioeconomic barriers for that person to take care of themselves. So once you're aware of that cultural part of how do you engage the community in it, because the cultural part is not just the family, but it's also the community, because this person doesn't have any family at this point, but there's a community surrounding them. And certain communities, I know that in a previous conversation we talked about, the church or priest or somebody in the community that people might get to and have other resources. So I think that, again, being aware of the environment, the culture, the community, the social aspects are very important for us in the healthcare industry. And that's why people are talking about social determinants of health. It's not just a checkbox in the EMR. It's really being in there and doing it so that patients can take better care of themselves. And again, better care of themselves doesn't necessarily mean adhere to a treatment, but take better care of yourself as a person. So I think it's fundamental. Once you break that barrier, you create a connection. Again, you create a trusting environment, and that's how you succeed in our industry. And I think it's relatable to many other industries.
Thank you very much. We are now really close to the end, but I want to thank everyone for participating and for being on the webinar. Thank you very much to Nicole. Thank you to Alex. Thank you to Dr. Daza. Special thanks to Melanie for graciously moderating this webinar. And if you get a chance, please head over to the website for the Center for Services Marketing and Management. We have a lot to offer, a lot of publications that you can sort through from our esteemed faculty. And as I indicated before, this webinar is being recorded and will be posted to the website. Once that happens, I'll make sure I send out a link to everyone so you can share it. Please do so. We had over 100 RSVPs and we didn't have as many people attending. I understand this is a busy time for a lot of people, but I'm sure that represents a lot of people who will be interested in seeing this at a later date. So thank you very, very much to our panelists. Thank you very much to Melanie for moderating. And thank you everyone for attending our inaugural Center for Services Marketing and Management webinar.
Thank you.
Thank you very much.
Thank you.
Thanks again, and everyone have a great day.
You too. Take care.
Thank you very much. It was excellent.
Bye-bye.
Bye.